Good afternoon. My name is Corinne Waldow. I'm the Senior Director of Economic Vitality at the Boulder Chamber. And I want to thank you for joining us for this week's cross-industry session with Boulder County Public Health. We'll get started and then we'll get to your questions as soon as Lane's done presenting. Please put your questions in the Q&A. We'll use the chat for pushing information out to you. So Lane, take it away.
Thanks, Corinne. Thanks everybody for joining, and good afternoon. We're going to run through very much the same stuff that if you've joined us in past weeks. I'll give you our epi update of what's been going on. We'll dive into kind of some of the dial stuff, and then talk about where we're at with some of the sectors within the dial, and then make sure we have time for question and answer. And I already see my next slide I didn't get fully updated. So we are not in orange, we're in yellow. So that is where we're at. The dial changed related to the metrics. So based on those new metrics, we are in yellow, and the governor did move us there last Saturday. So again, what's changed within that dial structure? It didn't change with the specific sectors, and we'll dive into that more just to remind you and refresh you on what those are. But what it did is it changed the metrics that are used to establish where we're at, and then the thresholds for the various levels were changed. So we used to do a 14-day rolling averages, and now it's down to a 7-day, which does give us a little bit more ability to be nimble for things that start to flow either direction. If we're seeing really positive trends, that allows us to move into more flexible phases, versus if we see poor trends and more disease happening, we can also move that direction. The one challenge I know for many of you who are interested in the 5-star, there was a prohibition the governor put that until the entire state has 70% of our folks 70 plus vaccinated with a single dose, we are not able to operate in the blue. The good news, and I'll share more details on that, Boulder County is likely going to be there this week. We have a few of our metro counties and other counties, which are the biggest drivers, that are a little behind us, but the governor has projected certainly by the end of this month, he believes that the state will meet that metric. So we're very close to qualifying and allowing people to operate in blue once the state is there. And then we talked last week, but if you weren't on, we are expecting a couple additional changes. The governor has given us a timeline for a dial 3.0 and then a final change sometime in the summer. And these should correlate as we keep seeing increased vaccination milestones, so that more and more of our community is vaccinated, and then we're going to see further changes in the dial that allow for more operation. This one's got a lot of stuff on it, but this was I thought a really good slide that Emily created, just walking you through the differences between the old dial and the new dial related to both the levels, and then again, what the criteria for us to be in those levels are. And again, a lot of the information on the new dial is all on the state's website. So you'll be able to dig into any of that as you see fit. This was as of Tuesday, but here's where we're at on our 1-week cumulative incidence rate. Again, in the yellow for our overall disease tracking, seeing about 133 per 100,000. And then for our positivity rate 1 week, we're at 3.1, which is in the blue category. So again, these are all good trends that we obviously would love to just have all our metrics in blue. So regardless, that would really show that our trends are continuing to be favorable, but that's a good sign. And then the hospitalization status, this is kind of fluctuating back and forth. We've seen blue and yellow, but 10 days of decreasing or stable admissions. We also have additional things that we're tracking related to hospital capacity. And so far, our local hospitals are doing okay, but they're still certainly seeing a lot of activity. Here's a graph you've seen over the course of our webinars, our tracking of those cases, so you can see the different trends. We continue to, have come down dramatically from the big spikes in the fall, but you can see we're still well above where we were in the summer last year. So we still would love to see things come down much further. And again, hoping that we're seeing a lot of things align with vaccination, but we still need that continued support from the community to really adhere to all those principles of social distancing and masking. This is just a busy graph of the trend across really the metro area to see that everybody is, for the most part, trending the same way. Douglas County, unfortunately, seeing a little bit of a spike there, but we are right here near the bottom. I think Jefferson County snuck ahead of us and is now got the lowest overall case rates, but that's good. We want to see all of those metro counties, especially ones with bigger populations, stay steered near the bottom here. Here's our vaccine. And actually, I think this, I don't know that I got this fully updated because this is, we've now actually have more people with a second course, and we're closer to 32,000 total residents that have been vaccinated. So apologize, I didn't get the new one in here. Here's where we're at. And this one, you can see this was as of just at the beginning of the week or end of last week. We were at 60%. So they're tracking this on a weekly basis. So we'll have an update tomorrow and expect that to be really close to that 70%. So, so again, doing really well at hitting some of the current target populations. And we want to just keep doing that. As I've said in past webinars, our real restriction is the amount of vaccine we're getting. Our local providers, we have a whole host of folks that are ready and able to give vaccines, but we saw a little bit of an increase than where we were the previous weeks. I think we saw 8,000 doses, and hopefully we'll see that trend continue, but we have capacity to do closer to 20, 22,000, and then some ability to stand up even larger clinics to go beyond that. So whenever we see, the vaccine really flowing in strongly, we'll be able to stand up a lot more capacity and get a lot more folks vaccinated. Just some key takeaways again from all the data. I didn't dig into all the various demographic stuff. If that's something that folks really do want to see, we can include more of that. But we do have all of that stuff posted on our website. So any of the data that you want to dig into, we have an extensive amount on our Boulder County COVID pages. But our case numbers trended up a little bit, just slightly from where they were the previous week. So we do want to really watch that to make sure we're not starting to go backwards, but we're still in that yellow phase. Our case rate trends are highly variable across the age groups. So we have seen some of the problem demographics go down, but then the other age areas go up. So we're really just watching that uptick in trend of cases. So we really want to make sure that stays under control. Still having those disparities within that Latinx community. So that's still an ongoing concern, and really focusing on increasing vaccination rates as well as looking at targets of how to address some of those disease disparities. We did see that increase in hospitalizations in Boulder, but overall the state did see a decrease. So again, it's a little bit of flip-flopping here and there, but all in all, we're still in favorable phases. This is the link to the COVID dial and the dashboard. So this is where you can dig in a whole lot more. I have some slides that I showed last week that I'll show again, but just want to make sure folks, as you need to dig in for your various sectors, you can see all the level of detail. You can also see the public health order that has all the official language in it. This was a slide I showed last week that kind of matched what the metrics were and what they are now. But again, we're right here in the yellow, pretty solidly in yellow, so not really threatening to drop back to orange at this time. And so hopefully we'll continue to turn that around and keep heading towards blue. Just some highlights. Again, go to the state's website so you can dig into this in more detail, but the in-level yellow, for the most part, sectors are at 50% capacity, and largely, or 50 people, whichever is more restrictive. There are some caveats where for really large spaces that you can get more capacity based on the space calculator, So that's would be, sort of that restaurant, more event center could potentially have more based on space calculator allowances. Last call is 11 p.m. Again, manufacturers, retail, personal services, limited healthcare, 50% of your posted capacity or 50 people, whichever is less. Events, 50% indoor or up to 100 people. There's different allowances based on whether it's seated events or unseated events. So you don't need to have as much space when you're doing a seated event versus an unseated. And again, the space calculators are used to help you to navigate some of those pieces. Outdoor, 50% or up to 175, again, based on available space. Group sports are allowed up to 25 people per activity. And again, if there's other nuances or other sectors that we didn't touch on here, they are all covered in the link to the current dial. 5-star, I'll touch a couple things, but let Corinne highlight all the things that she would like to share. The application process did open. Inspectors have been trained and there's ongoing training there. Inspections have happened. Corinne can speak to that firsthand. She's done them. So I'll let her give the rest of the 5-star update.
So, thanks, Blaine. Yep, we opened applications last Friday at 8 o'clock. We've had quite a few businesses apply. And after the application process, then you go through an inspection ready and we send out an inspector. I'm firsthand a trained inspector and have had the opportunity, and I'll say the pleasure of going out and inspecting some facilities. I've been very impressed with the level in which businesses are going about protecting the public health and the safety of the people coming in and the employees. So I want to say that all of the checklists and information are available on what is required to be 5-star certified on the webpage that I'll put in the chat. The other thing to note is that even though at this time we are in yellow and you can't operate in blue, we are approaching that 70% of the 70 plus. And it's important to note, we don't want a bunch of people applying all of a sudden at that last minute because we can't guarantee inspections will be right away. So it might be a good time right now to prepare to get your 5-star certification, because businesses that are 5-star certified will be the first to be allowed to operate in blue. And heaven forbid we go back the other way, those businesses will be able to continue to operate in yellow. So it's a great program. It's an insurance policy as we go up and down the dial as changes are made. The other thing to note is that it's a consumer confidence. A lot of stories, we've had a Fox 31, a Channel 7, a bunch of stories about 5-star certification across the state, but also in Boulder County. And consumers are becoming a little bit more aware of what businesses are doing in order to become 5-star certified, and giving individuals that confidence that they are going above and beyond or doing the public health measures necessary to protect both the employees and customers. So just note that that is one of the marketing and communication tools that's happening statewide in the 5-star program. Once a business is officially certified, we haven't actually given the certification or the certification out to many businesses at this point. The inspections just happened the last 2 days. We will have a running list of certified businesses on the 5-star page. We're required to have it, but we will have a running list of the businesses that have passed and are certified, and they will also have a decal on their front door. So I'm answering one of the questions that's in the chat. So we will have that as soon as, and the businesses will find out, and then we will put the list of businesses up on the page. If you have any questions, just let me know, but otherwise we're open, we're operating, and we're happy that it's moving forward.
Thanks, Corinne. We've mentioned this for many weeks now, but I really want to encourage folks, if you haven't signed up, the exposure notification system is another tool to help us quickly identify potential contacts and do that tracing work. This is a component that's important for 5-star businesses as well. So again, an important piece for folks to continue to share and use. You have found your way to the 1 p.m. session. We appreciate that, or you're watching the recorded version, which we also appreciate. We are not doing a session tomorrow, but we do have space and time reserved on Fridays for any issues that have arisen or if we see changes to the dial or any other program specific things. We have our Spanish session, which is recorded and should be shared today. And then finally, if you need to get a hold of our business team, here's our email, and then the call center's operational hours, and then the number for the call center. I think with that, we can move to questions.
Absolutely. So on the level change, the dial 2.0 slide that you had one of the points I don't think you went into much detail on, which is the flexibility to go up and down the dial and what has to happen for that and how that has changed. Could you explain a little bit about, what happens when you need to go up and down the dial?
Sure. So for us to move to blue, we would need to meet all of the metrics for blue and be stable there for 7 days. So that would be how we move forward. If we were to move backwards, similarly, if we start to see our metrics move to orange, that would be the process where the state is going to move us based on our metrics. There is not a petition process one way or another, but it's really a 7-day metric that's going to drive us moving in any direction.
So there's not the 14-day mitigation plan anymore, or this buffer time. It's going to be a lot more of a fluid system if those metrics are going in the wrong direction.
And again, we've seen an uptick. Hopefully it's not a significant trend, but another driver, if we were to move back to orange, that would still allow 5-star businesses to stay in yellow where they currently are, which is pretty significant for some of the sectors, the difference between orange and yellow.
Okay.
But hopefully we will see that state metric met here within 2 weeks to allow for people to potentially go to blue.
So a question I get a lot, and I think this is a confusion out there, is that when you go up the dial, it increases the capacity. But if your facility doesn't really allow you to increase capacity and still maintain social distancing, can you increase your capacity?
You're still limited to that either 50% or 50. So again, that's based on the size of your facility. So that is a big driver. So
but you still need to maintain the social distancing, the 6 feet between the yoga mats, the 6 feet between the tables. So even if it says 50, but your space is actually kind of small,
and you're gonna get a lesser amount. So that is an unfortunate piece that I don't see any changes to. Short of maybe us making it to green.
Okay, so some specific to industries. Are swim instructors allowed to touch participants in a group lesson format so the parents don't have to get in the water?
Certainly for safety issues, I think those are pieces that we aren't wanting to introduce additional safety issues. But otherwise, people should be maintaining social distancing in classes, in any kind of things like that.
So moving up the dial didn't necessarily open up, it's still asking for distancing, it just increased the capacity of the pools and so forth.
And so for those littler kids who can't swim at all yet, there might need to be some other parental support or someone from that household. So
we have someone on here saying, okay, we're technically considered an indoor event space, but 100 seems like a lot. Can we have somebody come and walk through and look at our facility? And I actually want to explain also on the social distancing calculator. So the 100 is what they say, but when you start to put in do the social distancing calculator, you have to put in the amount of space that's taken up by equipment, furniture, and you might find that 100 is too much for your space once you start putting in, 60% of our floor space is actually taken up by, in this case, it's a museum, so it's taken up by exhibits. So really you only have this amount of space and 100 might be too much, correct?
Yeah, absolutely. So that is a maximum. So it's not just everybody gets 100. You do need to look at your space and look at how much is available. We don't have staff that really can come out and do audits for you. But really, if you use those space calculators and you take out the space that's occupied by, again, if it's a museum, displays and things like that, what is your true free floor space? You're probably going to find a lower amount. And you can feel free to limit it even smaller than that. If you don't feel comfortable that you can manage groups and space, there's nothing that doesn't allow you to be more restrictive and have a smaller number. Those are just the absolute, maximums.
The only thing I'll say is that the 5-star certification program does include an inspector coming out and making sure that you have the safety protocols, the signage, the cleaning mechanisms. You have sanitizer in places you need sanitizer. So that would be that alternative to a public health staff coming out, but trying for the 5-star certification and having someone kind of look at your safety protocols. They also, some of it is, if it's an indoor event, they do look at some of the spacing issues.
And I did put the link in the chat to get to the dial, the dashboard, as well as all the different components that show about the level restrictions that we're in, the metrics that are used, so you can navigate that site and get to, and then where we're at as a county. So has all that information, and also as well as other counties. So.
And I sent that out in the emails. It gives you direct link to the orders, your capacities, and then I also still link to the guidance by sector, because the dial framework only shows you capacity, but starting to go through the sectors is important, because I got a question today: when can we have open houses? And if you go to the field services page, field services and real estate page, open houses are allowed as long as you're following indoor event guidance and using that social distancing calculator. So it's important to always still go to your sector guidance as well, because it will indicate what your capacity limits are by level, and knowing we're in yellow. And then it will also talk about the specific guidance for your sectors. Okay, do you know the average cases per day for Boulder County needs to achieve to be under 100 cases per 100,000?
Under 100, I think.
So to go to blue, basically.
Yeah, I think Emily had that in that slide.
While you're looking that up, I will answer the next question, which is whether limited healthcare businesses are eligible for 5-star. And they are. You can apply for in the limited healthcare. You're going to be listed under other businesses, because there is an additional items, or you might want to list under personal services, because some of the additional guidance is very similar to the personal services. So you can apply and just either list under other or personal services and follow those guidances. I would prefer you list under personal services and follow the guidance of the personal services. So the inspector is also making note of that, because there's a lot of crossover between those two.
So we would need to be 48 or less cases per day, averaging over that week, in order to get to the very top end of blue. And then all the way down to 7 per day. So if we can go below 7, then we're able to go to green. So.
And right now we're averaging in the 60s, correct? Cases per day in Boulder County?
Yeah, we were, I don't know if I had that metric on there, but our total was actually, it came down a little bit from Tuesday. I think we're down to 120 per 100,000 for the week. And we were, I don't know if I have that actual count.
Just following the news stories, I think it's anywhere from like 60 to 70 something per day recently. So
yeah, we've definitely dropped below where we were. We were seeing that 80 to 100, and I think it might have even gone below that, but I don't have that number. I'm sorry.
Okay. So, but that's a good thing, because we know that the daily camera, for example, reports every single day the number of cases and hospitalizations. So knowing that number, that below 40 something gets us into the blue, is something that we can all then track a little easier. It's easier to look back and forth.
For yellow, we if we're between 49 to all the way to 140, that's the yellow range, that average per day. And again, our 7-day total, we were in that 120 recently. So we're well in that range. So we're not being threatened right now to jump back to orange.
Okay. So I'm gonna make the next question 2 parts. If someone says that they're vaccinated, do they still need to wear a mask?
Yes, that's not likely to change. None of the hand washing, social distancing, mask wearing, none of that will likely change. And in some cases, quarantine may not even go away, even if you're vaccinated, depending on, again, your role. Just because you can still get the virus in your body and give it to others, you just likely will not have any symptoms. Some people possibly could still get sick. It's not likely, but it's possible. But there have been no hospitalizations and no deaths for anybody that's been immunized. So again, there's people saying, well, why should I really get this if I don't get all these freedoms? Again, this has killed a lot of people in our country, and it's hospitalized a lot of people in our country. So that's an important reason why it's important to try to get this virus under control, so we get more back to somewhat normal. But some of those control factors, I think, are going to continue for a while.
So the second part of this question is, I think we were going to look into this, was whether we can update the masking script to include what you say to people that come in and say, I'm vaccinated. So maybe that's something we can look at doing, is updating the dialogue or the script to include that branch on the script, because that is a new dynamic that businesses are facing.
Yeah. But we aren't providing any sort of variances to people that are vaccinated. So and I don't know that this has happened, but if people are saying I was vaccinated, so now I was told I don't have to do these things, that's not true.
Wearing their vaccination card as a badge of entrance kind of thing. Do you have any additional information on where essential workers, non-frontline essential workers, fall in the vaccination schedule now that they're no longer in phase 2? Phase 3, right?
Yeah, I wish I did, and we have seen so many changes to the governor's, priority lists, people that were prioritized that have moved out, others got moved up. And so unfortunately, we're kind of at that whim right now of waiting to see where things roll out. We're just focused on the current phases. As much as we are excited that people want it and are getting prepared, we're just trying to work through the current phases that we're in right now.
And there have been changes. So, we got an email earlier from somebody that used to be higher up, was ready to go get their vaccination, and is now no longer in the priority group, and it was denied because that priority group has now moved back as far as the schedule goes. And that might happen as these priorities shift. Again, they're shifting from the state telling the local health departments they have to follow these priorities.
Yeah, it is very unfortunate. And so we're hoping we at least can stabilize those lists so people can see them and trust in them. But unfortunately, the governor is making all those decisions. So we're not sure if they're stable or not.
So if you even look at it, it used to be like 1A, and then they created 1A, and then they created 1B, and then they created 1B1, 1B2, 1B3. So things are ever shifting and ever changing. And I think we said even last week, some of this is we're driving the buses, they're building the roads. So as we get the information, we send it out. There is a hotline at the state level. I sent this out. The vaccine hotline at the state level has 11-second answer time rates, according to the news released today. So they have 100 people working. They can answer questions in many languages. That's probably a good place to start, especially. And if they send you back to Boulder County Public Health, they might. But there is a pretty active hotline at the state site to answer vaccination questions right now.
And there's no local variance or no local decision to change that, or it unfortunately is what it is.
So one person on here said they're looking at restarting, group or community runs. Are there any guidelines or specific guidelines you have to follow for outdoor activities like this?
Yeah, so that would be that 25-person capacity. Certainly social distancing, since you're outdoors, if you can socially distance, you wouldn't have to wear a mask. But again, no close contacts. Other than that, yeah, they could run in groups up to 25, as long as they socially.
Probably keeping family groups together if if you have family members going together.
Yeah, and there's nothing to preclude you from being further apart. So again, remember 6 feet is a best estimate of a protective space, but more is more protective, especially when you're exercising and not masked.
Yeah, we want to still see people exercising, and we've seen some of those bike rides, and in some of those, I've seen some places look at the outdoor event guidance as well for some of those items, but those also require distancing and temperature checks and some of those other items as well.
Yeah, so the organized races and events, we do have folks that are reviewing those, and there are different allowances where there's waves of people so they can exceed some of those capacities, but they're still going to have to make sure that social distancing and those kind of components are built in.
Okay. So on the office capacity, and this has flip-flopped so many times, I don't even know if we can count it. Is it 50% of the desk spaces while maintaining social distancing, or is it 50% of the fire code?
It's 50% of the capacity, yeah. So that posted occupancy of the building room space. That again, that's still encouraging people to work remotely, and no reason to do things in person that can't be done virtually. So we don't still want to open that door, but it does allow up to that 50% capacity.
And you want to make sure that you continue to do distance, people distance, especially if they're working at the same time.
Yeah.
So we're not just trying to jam everybody into one room. You want to make sure that they have the distance, they're wearing their masks. One thing I've noticed which is kind of lagged or lapsed a little bit, are the symptom checking of employees, especially around office. When people call and say, I have somebody who tested positive and I need to quarantine. And I ask, well, do you have your symptom checks and your check-ins for those times? You're like, oh, I stopped that a couple months ago. That's still something that's very important, especially, if you have a case, in knowing who's in the office at any time, and to make sure that they didn't have any of the symptoms that are on the list. And in today's email, I resent out the symptoms list, the major and minor, and then the symptom check sheet, because I'm getting a lot of calls like that lately.
Yeah, and we're seeing new strains of the virus that are likely going to become more of the predominant strains, and they are causing more people to get sick. So it is something to really continue. The vaccines should be effective, but it's still, a small percentage of our population is vaccinated right now. So we're closing in on maybe 10% of the population has between 1 and 2 vaccines. So 90% don't. And then other counties maybe are at lower percentages. And we know we have people that work in Boulder County and live somewhere else. So.
And one thing that I've noticed doing 5-star inspections is one area that offices particularly, or manufacturers, are the common space areas. So, your conference room table, realizing, oh, if I have to maintain 6 feet, I might only be able to do 3 chairs at this table. We're moving those other chairs. I've also created more signs that say seating closed or do not move seating, so that you can designate where that seating is, so you can keep your conference areas open, making sure that they're cleaned. But thinking about those high top tables that have 4 seats around them, well, there's not 6 feet between 2 people. So really technically only one person, especially if they're taking off their mask to eat, should only be sitting at that table and cutting off the rest of those seats. So those are some of the things that, going through the 5-star process, you realize. And then having been an inspector out there, those are some of the things that I'm noticing that are not happening at some of the facilities. Any other questions? I'm going to do last call on the questions, and maybe we'll give everybody back 25 minutes today. Again, we put into the chat dial dashboard. I put in the chat a link to the Boulder County metrics, or the data that Lane referenced, that is on the Boulder County site. We also put into the chat the 5-star page. So if you want to apply for 5-star, now's the time. I can't guarantee, we hear we're going to have 70% of the 70-year-olds in the state, or 70+ year olds in the state vaccinated. I don't know why I'm vaccinated, I can't guarantee we'll be able to get you an inspection right away if we all of a sudden have a massive number of applications all at once as we move along in the process. So now might be the time to do it, especially since we have trained inspectors ready to go out there and inspect the properties. All right, with no more questions coming in, I'm going to say goodbye to Lane. Thank everybody for joining us. Let you know that I'll send along the recording, any changes, the recording to this and the Spanish webinar, any changes, and we will see everybody next week.
Thank you.
Thanks, Lane.